Good afternoon, student. So, in yesterday's lecture, we will discuss about the role of the homeopathy in the surgery. In that, we will study that surgery is an art that concern with the repair, removal, and replacement of the diseased tissue. Then, in the surgery, debridement, suturing, stapling is included with a skin grafting. Then we was discuss about the history of the surgery. In that, firstly we discuss the trepanation, that is the drilling of the skull for exposing the dura mater, that to relieve the intracranial pressure. Then Neolithic times, the cave paintings and recorded history gives the evidence of surgery in the prehistoric area. Then Egyptian pyramid also give the evidence of the brain surgery. Then the Shushruth, that is the father of the surgery, and his Shushruth Samhita is very well known in the India and all other world. He gives all examination, diagnosis, treatment, prognosis, and the numerous elements with the plastic surgery, cosmetic surgery, and the rhinoplasty. Then Hippocrates is the ancient Greek physician who gives the Hippocratic oath. Then in the China, Hua Tuo, who is the first person to perform surgery with the aid of the anesthesia. Then, in the Middle Ages, surgery was developed in the Islamic world by the Abul Qasim. And then, in the Europe, there is also many universities for the surgery. So, in the 19th century, Rogerius divided the surgery and medicine, and in late of the 19th century there is a degree of surgery scale, that is after MBBS, MS or CHH. Then modern surgery, that is Ambroise Paré, is developed rapidly with the scientific era. Then the evolution of surgery, that is from Shushruth era to the European world, then it transfers or travel to the modern surgery. Then surgery gives the importance that how to control a bleeding, pain, and infection. So in the early of the 20th century, there is a concept of infection was come firstly with the Agnes, who gives compulsory hand washing to decrease the chances of infection. Then Joseph Lister, who firstly experimenting with using the phenol during the surgery to prevent infection, and he he was the first person who used the rubber gloves. Then there is the antiseptic principle of the practice of surgery, and the pain control, that is anesthesia, was discovered firstly by the Horace Wells and the William Moore. Then John Smith, who is the firstly developed the ether and chloroform for the surgery. Then there are the general types of the surgery, that is elective, emergency, exploratory, amputation, replantation, and reconstructive surgery. with cosmetic surgery. This is the ancient circumcision set. Then transplant surgery, minimal invasive surgery, that is by using endoscope or laparoscope, laser surgery, microscopic surgery, bariatric surgery for the obesity, that is using a gastric bypass. Then conditions are treated by the surgery. So these all the points we was discussed in the previous lecture. Now we will discuss about the homeopathic viewpoint in surgery. So what is the role of this homeopathy in surgery? We all know that homeopathy is a highly scientific, logical, safe, quick, and experimentally effective method of healing. It offers long-lasting to permanent cure, treating the diseases from its root for more of the ailments. Then homeopathy is the most rational science with respect to its concept of the health, disease, and cure. So homeopathy does not treat superficially by just driving away the symptoms, but heal the patient from within. So undoubtedly, homeopathy is the medicine of the future. The remedies are prepared from natural substances to precise the standard and work by stimulating the body's own healing power. So, homeopathy is a medicine of the future as it is highly scientific, logical, safe and quick and extremely effective method of the healing. Homeopathy has it is a holistic medicine. It have magic of minimum dose. Then it is a better substitute to the antibiotics. Homeopathy offer wonder treatment for the viral infections. As we know, in COVID-19 also, homeopathy gives an excellent result in the COVID positive patient as well as it is very essential to increase the immunity level of every person. Then it often avoids a surgery. In the many cases, homeopathy avoids the surgery. It is answer to the allergic diseases. So where the allopathic medicine is ended to treat the allergic diseases, homeopathy start. As homeopathy have excellent results in allergic diseases in the other than any other mode of the treatment. It is excellent for the psychosomatic elements and ideal for infant and children. So, a near complete system of the medicine. So, in infant and children, we cannot use antibiotics. So, because antibiotics have the many side effects. So, in that case, in a pregnant lady, in infant, children, homeopathy have excellent results. Surgery come into play when physiological changes cannot be brought back to the normal position by medication. When the part becomes irreparable, we replace it or remove it and conditions improve. For example, when a tumor develops, not corrected by the medicine, we remove it by the surgery. So when there is an irreversible pathology, that is, for example, when there is a tumor, in tumor, when it is small, then we can treat it with the homeopathy. But it is a big tumor with the cancerous changes or any other tubercular diseases, say, then there is a need of the surgery to remove it. So homeopathy is not against the surgery, but surgery is an art and science by itself. Surgery is called the fourth in the conditions where medicine have limited or no role, and where surgical aid operation can cure or improve the condition. So, homeopathy is not against surgery because surgery is itself a art and science. And surgery, in the surgery, there is a removal of the foreign body or there is a role of the operation so it can cure and improve the condition of the patient. So, the master Robert sums up the position in an excellent manner that he writes, the homeopathic physician is first of all a physician, and yet there is that in each of our experiences that which compel us to go beyond the real progress of the physician and enter the domain of the special branches of the healing art. That homeopathic physician is firstly a physician and enter a domain in the special branches of the healing art. The surgery is one of these special fields that demands of each of us peculiar faculties and definite training if we would be the mean of conserving the work of the physician in the world. So this is especially true of homeopathic physician. Then surgery is neither homeopathic nor allopathic, but surgery is pure and simple. We are liable to err and place the homeopathy in an unfavorable position in the class of classes coming under our care. That try the skill of the physician and surgeon alike to decide whether a given case is surgical or medical. So it is very essential that we should be trained thoroughly to discover the line of the demarcation, the one from the other, and it is just blameworthy to decide against surgery and in its favor unless we are correct in our judgment, and it is the ignorance here that become a crime. So just as truly as when Hahnemann declared ignorance of the healing art a crime. So this is primarily a disturbance in the vital force, which is only functional in character. When there is a no apparent pathology and so surgery cannot be applied. So if the disturbance persists for some time and when the human being is not able to overcome this condition and it leads to the gross pathological changes which may or may not be brought back normalcy by medicines wherein the role of the surgery becomes of paramount importance. So remember that when there is a irreversible pathological changes, that pathological changes may not come back to the normalcy by the medicine. In that case, surgery is needed. There are a number of the diseases which are labeled as a surgery, where the homeopathy works curatively and can avoid a surgery. So some such elements are septic recurrent tonsillitis, piles, fissure in ano, fistula, appendicitis, except gangrenous. Because gangrenous is required emergency operation. It is emergency surgery. Chronic ear discharge, vocal cord nodules, polyp in the nose, ear, kidney, and biliary, small toes. Small size uterine fibroid, ovarian cyst, warts, corns, etc. So these are the elements can be covered curatively by using a homeopathy, and so it can avoid a surgery in these cases. So, Steele says there are many so-called surgical conditions which are really medical conditions where surgery should be incidental. Then he gives many instances to support these. He also quotes how Carlton had cured a case of tuberculosis of knee and another of aneurysm, while in both the cases amputation had been advanced. But as the patients had refused operation, they had been treated with the homeopathic medicine and cured. So, Steele says that there are the cases of tuberculosis of the knee and aneurysm. For these, patients suggested a surgery, but homeopathic medicine is treated that patient and cured is not. So, pathology is the ultimate of the disease process and not the cause of the disease. So, surgery eliminates the ultimate of the disease and not its cause. But These ultimate become a foreign matter, which is an obstacle to cure, and complete recovery is not possible unless these obstacle is removed. For example, sequestrum in osteomyelitis. So, Hahnemann, in the sequestrum in osteomyelitis, that in the case of the osteomyelitis, there is a removal of foreign matter is necessary. So, complete recovery is not possible unless there is a removal of this obstacle. So, for the OA, sequestrum removal is important. Dr. Hahnemann says in section 7 as well as in its footnotes that now, as in a disease from which no manifest, exciting, or maintaining cause, that is, causa occasionally, has to be removed. So, Master Hahnemann always said that the disease, the cause behind the disease, and is always present, and we have to remove it. So, unless and until the removal of cause is not occurred, then there is a no cure. It is not necessary to say that every intelligent physician would first remove this where it exists. The indisposition therapist generally ceases spontaneously. He will remove from the room strong smelling flowers which have a tendency to cause syncope and hysterical suffering. So, he said that there is a strong smelling flower which causes syncope and hysterical suffering. So removal of these can be treated the syncope and the hysteria. So extract from the cornea of the foreign body that excite the inflammation of the eye and loosen the over-tight bandage on a wounded limb that threaten to cause the mortification and apply a more suitable word. Laymaker and put a ligature on the wounded artery that produces fainting. Endeavor to promote the expulsion by vomiting of the belladonna, berries, etc. that may have been swallowed and extract foreign substances that may have got into the orifices of the bird. So the nose, gullet, ears, urethra, rectum and vagina crush the vesical calculus and open the imperforate anus of the newborn infant, etc. So when there is a strong swelling flower is removed, then there is a treatment of the syncope and hysteria. Also in the cornea when there is a foreign body inserted and there is the inflammation of, so removal of that foreign body is firstly important. They when there is a vomiting expulsion by vomiting of the belladonna berries. So extents like them have been the soil. An extract of the foreign substances from the body is necessary to cure the patient. So Stuart closed that the masters remark that I cannot be charged with having any undue leaning toward the surgery, but there are times and places where good skillful surgery is an absolute necessity. We must acknowledge that we are finite and that we have our limitations. So there are the times when we cannot find the remedy. There are the cases and state that mark a limit as far as any doctor should go in his own judgment with the internal remedy alone. You must decide where it is a surgical case and call in a surgeon to help you. So do not ever allow a patient to die on account of your inability to get the right remedy and put a call in a surgeon to help you. So Master Stuart Law says that there are some limitations in homeopathy. So in that cases surgery is needed. So Physician always know where is the role of the homeopathy in surgery. That is where we can use the homeopathy and where we can use the surgery. Then Dr. Muzumdar considered that the sick patient be treated with the indicated remedy and only should surgery be carried out so that the patient will respond much better to the surgery. So we can use the surgery as before the operative and after the operative. So it is that good homeopathic prescribing cut down the need for and the risk from surgery, but one has to discriminate the carefully and take advantages of all the advances and achievement of the surgery whenever it can supplement or even if necessary supplements the usefulness of the homeopathic remedy because ultimately it is the welfare of the patient which should be the sole deciding factor and not any personal predilection of the medical man. So surgery does not deal with the something is unknown which is residing in the body and which cannot be located. The concept of the disease in homeopathy is that disease is a total affection of the mind and body and the disturbance of the whole organism. So individual organs are not the cause of the illness, but disturbance at the inner level, that is disturbance of the life force and the vital energy of the body is the cause of the illness. So homeopathy treats the patient as a whole and not just the disease. Medical philosophy is coming more and more to the conclusion that the mere treatment of the symptoms and organ can only help temporarily and that it is the healing power of the body as a whole that has to be enhanced. So homeopathy believes in holistic, totalistic and individualistic approach. So Master Hahnemann says in his Organon of Medicine, that is in aphorism number 189, that and yet, with very little reflection will suffice to convince us that no external malady, not occasioned by some important injury from without, can arise, persist, or even grow worse without some internal cause. So, without the cooperation of whole organism, which must consequently be in a diseased state, and it could not make its appearance at all without the consent of the whole of the rest of the day, and without the participation of the rest of living whole of the vital force that pervades all the other sensitive and irritable part of the organism. Indeed, it is impossible to conceive its production without the instrumentality of the whole, that is, deranged life. So, intimately are all the part of the organism that is connected together to form an individual whole in sensation and function. So no eruption on the lip, no whitlow can occur without the previous and simultaneous internal in health. So next is the indications of surgery. Congenital anomalies, then the pathology of diseases may be causing excessive discomfort too and preventing the improvement or even threatening the life of the patient. So examples are aneurysm of aorta, excessive ascitic fluid and the pleural effusion, retention of urine, etc. So in these cases, mechanical interventions such as tapping, catheterization, etc. may be required to relieve the patient and promote the cure. So, firstly, we have to promote a cure. We relieve the symptom of the patient is very important. So in the case of the pleural effusion, in the case of retention of urine, there is a mechanical intervention such as tapping catheterization is necessary. So firstly, there is necessity to do this. Then in case of the injuries caused to the body from without, the surgical treatment is necessary only to the extent that the part injured require mechanical aid, whereby the external obstruction to cure is removed mechanically. But in such injuries, also the living organism require active dynamic aid to put in a position to restore the organism to health, and homeopathic treatment is called for. So, in certain diseases, a stage comes when the medicines, homeopathic or otherwise, cannot be much used, and surgery is required in those cases. For example, appendicitis, intestinal obstruction, hernia, and all sort of fractures. So, when there is appendicitis, intestinal obstruction, hernia, or the all type of this fracture is require emergency surgery or emergency operation. In that case, we can think of the surgery. On the one hand, surgery can play an important role in the medicine since some conditions such as congenital deformities, structural problems, severe injuries, or life-threatening pathological conditions are simply not treatable without it. And at the same time, surgery is often performed unnecessarily. For example, it is used when the body, given a chance, could heal itself using natural and non-invasive therapies. So sometimes there is a surgery is performed unnecessarily. There is no need of the surgery. In that cases, we can use homeopathy. Successful surgery does not mean that person is cured. Surgery may remove a tumor, gallstone, or other diseased tissue or the body part. But these removal doesn't change the underlying pathological process that created them in the first place. So surgery just remove a diseased part or diseased tissue. But the complete healing, complete cure is not done with the help of the surgery. It requires a homeopathy to heal the patient completely. Those so-called local melodies which have been produced a short previously solely by an external legion still appear at the first sight to deserve the name of the local diseases. But then the legion must be very trivial, and in that case it would be of no great moment. So, for in the case of the injuries occurring to the body from without, if they may be at all severe, the whole living organism sympathizes. There occur a fever, and the treatment of such diseases is relegated to surgery, but this is right only in so far as the affected parts require mechanical error, and whereby the external obstacle to the cure which can only be expected. So organ of medicine. In the organ of the medicine, that is the in the sixth edition, it is given that to take place by the agency of vital force may be removed by the mechanical means. For example, by the reduction of dislocation and by needles in the sixth edition, by bandages to bring together at the leaf of the wound, by the mechanical pressure to steal the flow of the blood from open arteries. In the sixth edition, by the extraction of foreign bodies that have penetrated into the living part, by making an opening into a cavity of the body in order to remove an irritating substances or to procure the evacuation of effusion or the collection of the fluid. By bringing into opposition the broken extremities of the fractured bone and retaining them in exact contact by an appropriate bandage, etc. But when in such injuries the whole living organism requires, as it always does, active dynamic air to put in a position to accomplish the work of the healing, etc. And when the violent fever resulting from extensive contusion, lacerated muscles, tendons, and blood vessels require it to be removed by the medicine given internally, or when the external pain of the scalded or the burned part need to be homeopathically subdued. Then the services of the dynamic physician and his helpful homeopathy came into the requisition. So, homeopathic outlook in the fracture is that the disease comes from within as a result of the disturbance in the vital force, and hence the treatment must be affected from within for the complete cure. The cause of the disease has to be taken into consideration for the successful treatment. And in case of the fracture of a long bones, deformity and sometimes a complete breakage of the bone occur, which cannot be set right by the medicine. So here the disease has not come from within as a result of the disturbed vital force. So this is to be corrected by the surgeon. As is the principle that surgery is the eliminating science, it removes the products of the diseases and sometimes the cause of the disease such as external force, foreign body or the any other condition. Dr. B.K. Sarkar in his commentary on organon has made this point very clear to in a simple word that what comes from within must be treated from within, and what comes from without must be treated from without. That is, where there is a dearrangement of vital force or vital force when there is a dearranged, then they require a treatment that cure a vital force from within. And when there is a foreign body or any external substance that present in the body so must be treated from without, that is by the external forces. Homeopathy in the field of the surgery. So it often avoids surgery. Homeopathy is excellent in prevention of pre-surgical anxiety and tension. Then homeopathy excellent in controlling the bleeding during surgery, excellent in a post-surgical complication, then in anesthesia effect in gastrointestinal disturbances like nausea, vomiting, constipation and flatulence, then in swelling, stiffness, bruise, pain and soreness. So including the gynecological and orthopedic. It Homeopathy is useful in case of the infection and in case of excessive scar. So homeopathy in pre and post surgery shows that homeopathy surgery at the best in an unpleasant process not only does the surgical wound cause pain, but general anesthesia causes its own side effect. Once it is established that surgery is necessary and homeopathic remedies can play a vital role in reducing any complication that may arise as well as accelerating the healing and recovery. So one of the homeopathy's best kept secret is its ability to prevent complications from the surgery. Homeopathy remedies can help to reduce fear and anxiety prior to the surgery. That is, when we can see aconite nepalus, that is aconite, is the first remedy for the sudden and violent onset of the shock or trauma, accompanied with the fear and the anxiety, which are common emotions experienced before surgery. So this is a remedy is most effective when the patient fears dying from the surgery. So aconite is a very important remedy to reduce fear and anxiety prior to the surgery. Then gelsemium. Gelsemium 30C is a common remedy for the person who experiences a great anxiety, apprehension, weakness and trembling prior to the surgery. So gelsemium is also good remedy for the surgery, that is before the surgery. When faced with the anxiety, gelsemium or aconite the night before the surgery and another dose or in the morning of it, fear or anxiety persists after surgery, up to 3 more doses may be taken. So doses that is just at before the night of the surgery, then at the day of the surgery in the morning, and if fear persists, then given the more doses 3. When there is excess bleeding during the surgery, so if surgery possesses the potential for a large loss of blood or undergoing the intravenous, that is the IV therapy, in that arnica montana, it reduces the bleeding during the surgery and prevent the blood from the pooling under your skin and minimizes the surgical shock. So if the surgery possesses the potential for a large, when there is a loss of the blood or a vital fluid, then in case arnica montana is useful. Recommended doses are 30x or 30C of arnica the night before the surgery and the morning of the surgery and just prior to the surgery. Then stop the post-operative bleeding. Bleeding occurs frequently after surgery and most people can reduce it with the arnica montana. But following remedies can be used when it suits a specific symptom. When the excessive bleeding lead to the great weakness, burning pain, restlessness, anxiety as well as thirst, then arsenic album is useful. Synchronophilia work best if bleeding and a loss of fluid like sweat or urine causes to feel